Each year, bone marrow disease affects thousands of adults and children in the United States. Occurring when there is some kind of abnormality or interference with the production of blood cells, bone marrow disorders can result in diseases such as leukemia, aplastic anemia, lymphoma, sickle cell disease, multiple myeloma, and myelodysplastic syndrome, or MDS. Often life-threatening, transplanting healthy marrow is often the best and only hope for treating these conditions.
Some of the diseases that cause problems with the bone marrow are failure of the bone marrow. The bone marrow does not produce the blood cells that it should do. There's also another big group of conditions, cancers, which can either be within the bone marrow or outside the bone marrow, for which bone marrow transplantation can be useful. Bone marrow transplantation can help provide high-dose chemotherapy for those cancers and can in some cases provide an immune response against the cancer itself.
There are two common types of bone marrow transplants performed today: autologous and related and unrelated allogeneic or umbilical cord transplant.
The two main types of bone marrow transplant that are performed can be categorized in this way. Some bone marrow transplants, we use the patient's own bone marrow stem cells to support chemotherapy that we give the patient. That's called an autologous bone marrow transplant. And the other type of transplant is where we use a donor's bone marrow. That is called an allogeneic transplant. And in that situation, we use a donor, which can be a patient's relative, it can be an unrelated donor, or it can be cord blood.
For patients facing a bone marrow transplant, choosing a treatment center can be a difficult and overwhelming decision. Finding the right combination of qualified and compassionate care can ease the patient's mind and improve treatment outcome. The physician team at the Blood and Marrow Transplant Program at Northside Hospital in Atlanta understands this and is dedicated to providing the best of both worlds: clinical excellence and compassionate care. Here, patients come first, and it's a philosophy that directs every step of an individual's treatment plan.
The Blood and Marrow Transplant Program at Northside Hospital focuses on providing the best care for patients and their families, and one of the reasons we want to put our patients at the top of a treatment pyramid. They deserve the best care, they come here expecting the best care, and we want to make a promise to them and deliver on that. Our physicians and our clinical team and all of the supportive staff work around a structure of quality and expertise and are extremely dedicated to providing this level of expertise so the outcomes of our patients exceed our expectations and hopefully their expectations.
My experience at the Bone Marrow Transplant Program at Northside Hospital is nothing short of amazing. The innovation, the level of compassion, the support, and the fact that you are making history with a group that is leading and pushing the edge and redefining how others do medicine. I not only am exceedingly and deeply grateful to them, but I'm honored to be a patient and to be part of them changing how we treat cancer. And there's no greater gift.
It is this commitment to quality care that has resulted in the program achieving the best related and unrelated allogeneic donor transplant survival outcomes in the nation for the last 4 years. Northside-BMT is also one of only 2 programs in the nation to exceed the 95th percentile in survival outcomes for the past 4 consecutive years, truly making it one of the most qualified and experienced transplant centers in the United States.
The reasons that we've achieved these survival rates and this sort of success is that this program is rather unique in that it singularly focuses on the patient. Here, our primary objective is to achieve the very best outcomes for our patients. And that differs from more traditional programs where successful outcomes in treating patients is just one of the parameters they deal with. Very often there are other things like administration, like teaching, that sometimes become more important in those centers than achieving great patient outcomes. In contrast, this program focuses on that as our primary and really main goal, and we continuously strive to achieve the best outcomes that we can.
In addition, in 2011, the BMT program at Northside Hospital was invited by the National Cancer Institute to join the prestigious group of core clinical centers for the Blood and Marrow Transplant Clinical Trials Network.
What that means is that we are one of the 20 largest and best clinical transplant programs in the nation. We were selected based upon our size and our commitment to clinical research. This network is the premier federally funded network to perform clinical research in the field of bone marrow transplantation.
Since its establishment in 1997, the Blood and Marrow Transplant Program at Northside Hospital has striven to become not only the premier transplant program in the Southeast, but one of the very best in the nation. A strong commitment to clinical research in the field of stem cell transplant is an important component of achieving this goal, and to providing potentially life-saving treatment to patients who, in the past, would not have had access to transplant therapy.
To step into a program and an arena that is not only good, but the best at what they do. Only the best will do when you're fighting for your life. And in the moments when you need to hang on to something, that alone can put you through.
Clinical research is extremely important to this program because that is the way we advance bone marrow transplant treatments for our patients. Furthermore, clinical research provides our patients with access to the latest and best new therapies in the field of transplantation. The ways in which we are advancing this field through clinical research is firstly by participating in the large national network clinical trials, but we're also developing new and innovative therapies here at our own center. One example is that we have pioneered the use of donors who may not be fully matched in patients in whom a fully matched donor is not available. We've been very successful with this approach and expanded transplantation for patients who may not otherwise be able to access it.
Caring expertise. The Blood and Marrow Transplant Program at Northside Hospital in Atlanta, Georgia. To find out more, please visit bmtga.com or northside.com.